Almost 7 million cases of COVID-19 have now been reported to WHO, and almost 400,000 deaths. Although the situation in Europe is improving, globally it's worsening. More than 100,000 cases have been reported on 9 of the past 10 days. Yesterday, more than 136 cases were reported, the most in a single day so far. Almost 75% of yesterday's cases come from 10 countries, mostly in the Americas and South Asia. Most countries in the African region are still experiencing an increase in the number of COVID-19 cases, with some reporting cases in new geographic areas, although most countries in the region have less than 1,000 cases. We also see increasing numbers of cases in parts of Eastern Europe and Central Asia. At the same time, we're encouraged that several countries around the world are seeing positive signs. In these countries, the biggest threat now is complacency. Results from studies to see how much of the population has been exposed to the virus show that most people globally are still susceptible to infection. We continue to urge active surveillance to ensure the virus does not rebound, especially as mass gatherings of all kinds are starting to resume in some countries. WHO fully supports equality and the global movement against racism. We reject discrimination of all kinds. We encourage all those protesting around the world to do so safely. As much as possible, keep at least 1 meter from others. Clean your hands, cover your cough, and wear a mask if you attend a protest. We remind all people to stay home if you're sick and contact a healthcare provider. We also encourage countries to strengthen the fundamental public health measures that remain the basis of the response: find, isolate, test, and care for every case, and trace and quarantine every contact. Contact tracing remains an essential element of the response. In some countries, there is already a strong network of health workers for polio who are now being deployed for COVID-19. Last week, we published guidance that describes how existing polio surveillance networks can be used in the COVID-19 response and outlines the measures that should be put in place to maintain an effective level of surveillance for polio. WHO has also published new guidelines on the use of digital tools for contact tracing.